I am Dr. Swannie Jett, and I have a passion for public health for over 30 years. Now, I'm in a position to affect change. And these are the critical conversations about health in our community with the people who can help me make those changes. Good morning. Welcome to CEO Live Talks. This is our second episode with Miss Martin. So, my experience, and I've traveled to Africa probably about 3 times now. But Senegal, when I arrived, people actually met me at the plane and said, "Welcome home."
I love that.
And that was an experience that just changed the whole narrative.
Yeah.
Watching TV and you see all the movie stars that we'd never see in the U.S. on TV. Commercials, of course, I was over there doing Ebola, so I saw some horrific things, but it gave me a different appreciation. I could just sit and watch TV all day and learn. And then to see all 51 countries come together, all the presidents. I saw movie stars in person and, soccer players, which they call football. It was a totally different experience.
Yeah.
It was a life-changing experience.
Yeah.
And then I was in Dakar, so I was right on the ocean.
Ooh, yeah. It's on my list. It's goals.
So yeah, and then I would see crabs that were assorted colors, not just one color. And there's things that you don't see, you don't even think about.
Yes, were those crabs delicious?
They were delicious.
Yeah, right priorities. Did you eat those crabs?
I ate those
and were they fired?
They were good.
Good.
So that we went down that rabbit hole, which is good for people to hear.
Yeah. No, thank you for letting me reflect. Like, I just got back a couple weeks ago, and I'm still just figuring out what to do, with the experience. And if I could do anything in the entire world, if I had all the money in the world, it would be to load up some planes, and take specifically young people, to, it used to just be to take them to travel and give them international travel experiences because we learn so much, about ourselves when we see other parts of the world. But now specifically, I would load up a plane, of young people and take them to West Africa.
So hold that thought. I have a friend, Dr. Jeremy Levitt, that takes a group of kids to Africa every year to Senegal.
I love that. Yes.
So we could definitely collaborate on that. I plan on going on the next trip.
Okay. No, that's amazing.
So I'll let you know.
Thank you. Thank you.
So now you graduated from UK. You have left behind this English
this English degree.
This English library. Steward reading 3,000 books and writing them too.
Yeah. All the above.
All the above. So what did you progress to?
Yeah. Well, a part of my undergrad experience, which was also really important to me, is I did the travel abroad program for a period before I graduated from UK. So I went to LSU for a year, and I talked about jumping off the porch in the West End. No, I jumped into life in Baton Rouge, is where LSU is, but New Orleans is an hour down the road, and I was there every chance that I could get. But it's where also I experienced, since we've talked so much about, racial relations, I experienced a completely different side, of race relations and racism, and also kind of like a cultural resilience. So I learned a lot about myself in Baton Rouge, at LSU. It was the furthest I'd ever been away, from my support system. So I learned that I could survive, that I could do it, on my own. And not that we're ever really alone, but I felt empowered, just and more independent than ever, but also learned a great deal about African-American history in Louisiana and women's history, in Louisiana, where we have the world's given us so many, great leaders from that area. So I don't like to pass that part up when I think about my undergrad experience. I did a year of studies focusing on women and African American studies at LSU. And then the summer before and the summer after, I had more fun than I've ever had in my life. I also learned how to cook. That's where I really learned how to season well, learned about the Holy Trinity, right? You got to have 3 ingredients, otherwise, yeah.
You learn that stuff, New Orleans.
Yes, that's right.
Louisiana style.
That's right. But after undergrad, I just went into the workforce a little bit. I knew I didn't want to go straight into school, but my thought was that I was always planning on going to law school. And I'm really grateful for those years, right? I'm glad that I didn't jump straight into school because, again, experience is the best teacher. And I really stumbled into the career path that I know I was meant to be on. Initially, like my father, right? I was probably working 3 jobs, right after, and it wasn't, nobody was making me, nobody forced me to. I was still staying at home with my mother, but I knew to keep a full plate. And I liked to have my own money, and I liked to learn, right? And working was really an opportunity to learn about these different industries. So for a while, I had started working at a law firm. Again, I was preparing myself for my career in law, but it was a debt collecting law firm. So also, right, I learned a lot of lessons there and just about economic hardship, right? That how the law does work, right? How it is used to right, to in many cases, right, keep people, right, impoverished, et cetera. We don't have to go down that rabbit hole right now, but I was working at a debt collection law firm, and I was working at H&R Block. And I was doing some other I was working at the golf course at that point.
So you do taxes, golf course, debt collector.
Yes, all of the above.
You really don't have to go after people's money.
Yeah, well, hey, I got that from my dad. The golf course was low-hanging fruit. I had really...
Did you learn how to go?
I had been, so we talk about schools, right? I very much believe that the greatest lessons we learn are not inside of a classroom. Where I learned a lot of my early lessons was on the golf course, right? I started playing golf when I was 5 at Swannie Golf Course. Course, I was a part of what was then the T-Swingers, right, which is now First Tee. And my grandmother made sure that me and my 2 cousins, right, who I said were really raised as my siblings, that all of us knew how to play golf, right? What she knew is that business deals happen on the golf course, right? And it is a language that will serve you well.
I'm sorry, right? You never want to be on the tour.
Yeah, well, it just wasn't. I had dreams of that one day, but I didn't have the discipline, right, that it took for me to really be a professional golfer. But I had a lot of fun, right, and I learned a lot of important lessons and met a lot of people who are still a part of my community now. So I was saying that to say, throughout, the golf course was the first job I ever had. So when I was in high school, the golf pro who was at Swannie, Kevin Greenbow, really embraced me, allowed me to work right there, learn the game, but also learn, like I said, a lot of lessons, right? You learn a lot about integrity, right? Sportsmanship, right? You with on the golf course, unlike team sports, you are playing yourself.
Playing yourself.
And I think that has served me well, just, knowing that you are your only really opponent, and you make or break, right? How you respond to that bad shot or that mistake, right, is gonna have the biggest impact, right, on what happens to you next. So keep your cool. So the golf course was my first job, but out of college, I went back. I was working at the golf course. I started working at H&R Block, and then I was working at this law firm, thinking I was going to law school. Funny story that really kind of put me on the trajectory that I am now. When I was at the tax office one day, there was a family who was in front of me, and I'm trying not to get myself canceled or sued, but long story short, they were gonna pay me, right, in the agency, like $400 to do a tax return that was gonna take me 20 minutes to do, and that was like, it clicked, and it was like, I could do this woman's return, and I can, charge her all this money, or I can empower her by teaching her to do it herself, save her that money, and then that's money that she has to put back into her family, into their well-being. So I was quietly, because I knew I was wrong, right? Quietly, at my desk, like, ma'am, you do not need to pay me to do this. Like, go download this, right? Or, go to this website. I was laying out the options, and you need to answer these questions, X, Y, and Z. It was a very simple return. And she left, right? And she took that advice, and my manager at that tax office, instead of firing me, right, as they should have done, made it clear that your role here, right, is to make revenue for the company, but I see that you enjoy educating people. That individual was also he was involved with adult ed, right? Adult ed, JCPS is adult education program, and said, maybe you should consider teaching adult education classes. And that's really how I got started in teaching, right? And in adult education, which is really where my career, as I know it now, started.
Hello, my name is Sierra Clark, and I'm the Chronic Disease Manager at Park DuValle Community Health Center. Ever since I started at Park DuValle over 9 years ago, I have been committed to helping patients live healthier lifestyles. I am currently serving patients in the Chronic Care Management Program, or CCM program. My team and I help patients manage their chronic conditions such as obesity, high blood pressure, high cholesterol, and diabetes. In this CCM program, you will receive several benefits to help you manage your health. We offer monthly telephone calls to check in with your progress and to assist you with any concerns, assistance with scheduling your healthcare appointments, and assistance with filling your prescriptions in a timely and convenient manner. We also offer many resources to help you with the barriers you may face with eating healthy, being physically active, or monitoring your conditions at home. For more information, visit us online at pdchc.org or visit one of our health centers.
Hello, I'm Dr. Swannie Jett. Please make sure you visit one of our 5 locations, not only in Louisville, but outside of Louisville and surrounding areas. Thank you. You have a life of selfless service, and now you're at St. John's.
Yeah.
Walk me through it, because you have a lot of outreach going on. You have a lot of helping people get into homes.
Yeah.
You got a lot of programs.
Yeah. No, I appreciate you asking. I would have been very sad if I walked away and did not get to share the really important and challenging work.
Especially it's 10 degrees outside. It's cold.
It's the work that we do is life-saving, right? It is essential, and I'm grateful I'm a better person every day because I get to walk into that building with people, right? Really a community, not just my team, but volunteers and just other concerned citizens who all come together and say, right, this is a problem that we have to solve, and use our resources and our talents to help the people who are the most vulnerable. It's a gift, right? And the same with other things. When they first gave me the job, I felt a great sense of that imposter syndrome. It's like, well, this is a big problem, right? I am not qualified to do this work. Why me? But now I realize that I'm exactly where I'm supposed to be,
especially
and grateful.
The third person in 35 years to run the...
Yes, absolutely.
So like,
and I mean...
What do those other people do? They've been here forever.
They've been here forever.
That means you got to be here for a long period of time.
Yeah, I've written a book in my mind about what it's like to succeed a leader, right. Who was amazing, but who had been there for so long, and right, and how that culture, it's very we might co-write, right? We might co-write the book. But St. John Center, so yes, for 37 going on 38 years, we've offered homeless services. It really started as a day shelter. So the day shelter is our flagship program. It used to be known as St. John Center for Homeless Men, because at the time that we were created, there was no place for people, specifically men, to go during the day.
There was a place for women.
Yes.
Yeah. I've been around Louisville a long time.
I know. Yes, you've done your research and you've interacted with all of these different services, because it's all connected, right? We know it's all connected to health.
Health centers, everything.
What I'm trying to convince people of more and more every day is like, homeless services and housing is healthcare, right? So we have a whole another conversation about that. But we started as just a day shelter, right? At the time when we started, the day shelter was also was also home to what is now Phoenix Healthcare, right? So it was a place for people to be, to get out of the elements, right? To connect to some services, right, that they needed to get out of homelessness. And then there was also a healthcare facility inside, right? Since then, we have grown tremendously, really, to meet the need, right, of the unhoused population, as, we are seeing increasingly, right? There's more and more people.
I left 2013.
Yeah.
I came back in 2021. But actually, I came back during the protest for Breonna Taylor.
Yeah.
Of course, I dealt with this in Florida with Trayvon Martin since I was in Sanford. And I dealt with homelessness there. 1/3 of the homeless in the nation lives in Florida because it's warm.
Wow. Yeah. I mean,
a lot of people don't know. So I sit on those coalitions to help. The interesting thing I saw coming back here, and I'm still astonished, is that it has grown 3 or 4 times.
Yeah. And, despite what we are led to believe, the problem is the housing shortage, right? For decades now, we have been underinvesting, right? And really divesting in housing, right? Specifically affordable housing. And so now what we are seeing is the lack of that investment, right? So leading to a housing shortage.
We've used that term a lot. What is affordable?
So affordable, and people do use it, right?
Yeah, they use it a lot,
in different ways. Affordable to us means housing that you can afford at 30% of your income, right? So whatever your income is, if you should not be paying more than 30% of that to cover housing.
Okay.
All right. And we are about 70,000 units of affordable housing short for the people who are at 30% AMI, right? So it's kind of a double whammy, right? If you will, people who are already living below, right, the poverty threshold are also the ones who are facing the greatest housing shortage, right, in terms of both availability, right, but also affordability. So we are seeing more and more people not able to meet ends meet because the cost, and it's supply and demand, right? If there is not enough of the supply, right, and the demand is up, then people can charge more for it. So the rents keep going up, but income isn't going up. All right, people, that's whether you are working or whether you're on a fixed income. So every day there's somebody else who is unable to afford the cost of housing. And then landlords are incentivized, right, because they can charge as much as they would like to because there's a shortage, right, in the supply, and they can get paid. They can get what they want for it, and there are no sort of like rental caps or anything that protects, right, the renter.
That goes back to, I remember this in Boston. They actually had a cap.
Yeah, there are other cities that are states too that are passing legislation that protects the individuals so that housing remains affordable. And we have just not taken those steps yet.
That's one step that can be taken. Just a thought, and I had this thought a while ago. We have so many vacant properties. It seemed like the city would take these properties, renovate them, or turn them over.
Yeah.
And that's a good place to house people.
Yeah. And a lot of this I've learned more about housing development in the last few years because we've been working on our own housing development project. And as we work more with different partners like the Coalition for the Homeless or Metropolitan Housing Community, I'm learning, right, why is it so difficult, right, to create housing or to turn a vacant property into housing. And there are a lot of, sometimes it's just cost, right? I've been taught that it's often more expensive to rehab a property and convert it to housing than it is to do a new build, right? So we get all of these old buildings around, and
that is true.
Not a lot of people incentivized to rehab them. But the Affordable Housing Trust Fund is working on a plan now to make that just to encourage investors to do just that. A big problem that we have in Louisville is our zoning laws, right? Zoning, we have exclusionary zoning laws, which prioritize the development of single-family households, right? But when we actually need multifamily, right, households, and we need everything in between. So like last year, we just passed the a legislation that will allow for us to have accessory dwelling units, which to me, I just summarize, and housing expert might correct me, but to me, it's just like building a guest house, right, on your own property. We've just made those things legal again, right, for people to develop. But duplexes, threeplexes, fourplexes, right, we have to be able to, in order to fix the supply issue, we have to be able to develop housing, right, that meets the diverse need, and our zoning laws prevent us from doing that. So that's one of the reasons. And then, you know, there's a lot of NIMBYism here, which NIMBY is acronym says not in my backyard, and the best of us have done it, right? And you know, it's basically like, yes, we need housing, we want you to develop it, but you can't develop it here, right? And we see that most often, right, in our prospects, right, in our northern commons when it comes to creating affordable housing, because people think incorrectly that affordable housing means projects, right? We're building a project, we're building, and that is not at all correct.
We are here in the community. We partner with our community health workers to run vaccination clinics throughout the city of Louisville, specifically downtown and the West End. The importance of events like these is that a lot of people have transportation issues, so we are able to come out into the community and get people the vaccinations that they need.
So it's really important to have these type of events in the community because, you know, as we know, when COVID and flu season comes around, our underserved communities are hit the hardest. So if we can bring any vaccines or anything that they need, glucose testing, it's important to meet people where they're at.
At Park DuValle, we care about the community. We do events like this monthly because we are the community and we love to give back to the community.
Be sure to visit our website for more of our upcoming community outreach events.
For more information, visit us online at pdchc.org.
So I would tell you, and I laugh when you say that. I was health commissioner in Brookline, Massachusetts, and you had to meet a 10% threshold of affordable housing in the community. And they would build these units, and I think they might have offered 20% affordable housing in these units. And I would have people, physicians that worked at Harvard, would send me emails of pictures of other housing that this company did to say they got trash out the back. I don't want it in my backyard. 3 a.m. in the morning. I was like, what is this person doing up at 3 a.m. in the morning to send me pictures of trash?
Policing the trash.
Like, don't you really got to go to somebody?
I mean,
so I understand.
We got to prioritize the root, right, of it all is if we prioritize people, right, over property, then we will move forward. We can move forward, you know, exponentially, right, and actually start to solve the root cause, which is the lack of housing, whether it is in Prospects or whether it is on Cane Run Road, right? We have a housing assessment, a housing needs assessment that shows we need affordable housing across the city, across zip codes, and we have to start to address, right, the policy that is preventing us from doing that.
And what about tiny homes? Because I know Florida, we started to move toward that model of tiny homes.
I'm a big fan, right, of tiny homes. I think in the last couple of years, we started to invest in some ideas that are getting us closer to that, right? So oftentimes before we get tiny home villages, we see safe, what we call sanctioned encampments, right, which Louisville invested in the first one about 2 years ago with the Hope Village, right, which they're doing really important work over there. So to define a sanctioned encampment, it's just a place where people can legally camp, right? Instead of camping where, you know, somewhere where they are going to be cleared, right, or asked to relocate. It's a designated spot. So for a long time, there was just no appetite for that, right? Only opposition. But as we are seeing more people who are falling into homelessness, and once you fall in, it's really hard, right? It's really hard to get out, and you know all of the reasons why. We have finally started to, recognize, right, the viability of these types of resources. So we have the Hope Village now, which can house 49 to 50, right, people or couples there, and they are still camping outside. Not a long-term or permanent solution, but it is a transitional option, so that as different team, as the community is working to get that individual into housing, they have a safe place where they can be, where we know that they have the resources that they need, but also so that service providers like St. John Center and other agencies have a place that they can go and find people. Right.
So, quick question: has the hospital sector stepped up and put money toward reducing homelessness?
In various ways, we've gotten. Historically, right, Norton's has always been supportive of our work. We lean on U of L. We're right next to, we're in the Lou Med district, so we've always been able to lean on the hospitals, right, for kind of in the moment support, right, some financial support. Is there an opportunity for the hospitals to have a bigger part, right, in addressing homelessness? Absolutely. And I think they are recognizing, medical professionals are talking about Z codes.
Because I worked, I sat on the board for Florida Homelessness Coalition. And the Coalition for the Homeless, which changed the name because they got into healthcare as well, they stopped running the health center, which was Carver Burns. Received $40 million from Advent Health.
We have not received $40 million, right? And the coalition, I'm on the Coalition for the Homelessness board, we have not received that level of support from our hospitals here in Louisville. We lean heavily, right, in terms of client services on Phoenix Healthcare, right, which is the part of family health centers and the homeless service providers. And they are actually going to be our partners in this new facility, this single site model that we are creating. It's called Sheehan Landing, but because there are so many health conditions, right, that impact a person's ability, right, to stay housed, the facility will include a healthcare, right, facility. So Phoenix Health is already on board, right, and is going to send staff there. Peace Hospital has committed, right, some support. We are looking for other, right, providers and other,
At Park DuValle, I've been thinking about it. So
okay.
We're going to move in that direction.
Yeah, we're ready to have a conversation.
Okay.
But there's an opportunity for, right, the hospitals and just all kind of medical care providers to not only provide financial support, right, that makes these kind of models more sustainable, it makes future developments possible, but we actually need, people to staff these facilities along with us so that the model works.
So one last question as we conclude the show.
Okay.
If you could wave your magic wand, how would you solve this problem?
It's such a, you knew, right, how difficult of a question that was, because there's so many layers, right, and complexities. If I could wave a wand, I guess I would invest where I said, the root cause is there would be housing, right, aplenty. There would be housing that was affordable to everybody despite, where they are, right, despite their own income. There would be housing available that they could afford across the city in every neighborhood, because people deserve to live where they work and where they go to school at a rate that they can afford. There'd be housing for everybody. It'd be like Oprah. You get some affordable housing. You get some affordable housing. It would be everywhere. That would be my wand.
and that was the answer I was looking for.
Very good.
Thank you for joining in the show. This concludes CEO Live Talks. Thank you.